Start.
Myself, Dr. Sharif Tadvi. I'm a practicing physician in Navi Mumbai area. Today I'm going to give a talk on diabetes with regards to Diabetic Day, which we are celebrating on 14th November this year. And the theme of this Diabetes Day is Eyes on Diabetes. So I'm going to speak on what do you mean by eyes on diabetes. Eyes on diabetes means we have to keep diabetes under control with the proper medications as well as with the proper consultation with the doctor. So what is diabetes? Diabetes is a metabolic syndrome. It's due to decreased insulin sensitivity or decreased insulin secretions by the pancreas of the concerned person, which leads to increased sugar levels, and that leads to the complications due to increased sugar levels. The types of diabetes are: one is a non-insulin dependent diabetes mellitus, and first is insulin dependent diabetes mellitus. That is, we also call it juvenile diabetes. So, what are the complications of the diabetes? Uh, Pathologically, there are microvascular complications as well as macrovascular complications. What are the macrovascular complications and what are the microvascular complications? Macrovascular complications leads to the retinal changes, that is a diabetic retinopathy as well as diabetic nephropathy. And macrovascular changes leads to the complications of the heart due to diabetes, that is silent myocardial infarctions or cardiomyopathies or ischemic heart disease, as well as the macrovascular complications leads to the diabetic neuropathy, that is the disease of the nerves, which leads to the tingling, numbness and burning sensation all over the body, mostly in the lower limbs, as well as this leads to the diabetic neuropathy and a diabetic gangrene of the foot or the upper limb. A second severe complication of the diabetes is diabetic ketoacidosis, which means whenever there is a increased sugar levels, that leads to the acid formation, acetone acidosis in our body, and that leads to diabetic coma, and patient may land up in multi-organ dysfunction syndrome due to diabetic ketoacidosis, and it is a very severe kind of complications of the diabetes in a diabetic person, or those who are not detected earlier, or those who have not checked their sugar levels earlier. So how to prevent these diabetes and diabetes complications? First is a lifestyle modification, in which we have to keep our lifestyle very normal. That means regular exercise at least for half an hour daily, as well as our balanced diet. That means no excessive salt, no excessive sugar, or no excessive oil in our diet. So that is a lifestyle modification is the first step in controlling diabetes as well as other complications of the diabetes. Second is the if you are detected for positive or you are detected for a diabetes, increased sugar levels,